Across most African cities, there is little information on how risk accumulates over time, where, who is affected, and why. Addressing this challenge calls for a close examination of the links between disasters and urban development, and a shift in focus from large-scale events such as earthquakes to capture everyday risks and small-scale disasters that increases the vulnerabilities of low-income dwellers to multiple hazards over time. Grassroots-led data collection and mapping can inform and strengthen community local government partnerships for risk reduction and bring to the fore the full spectrum of risks experienced by poor women and men, ranging from everyday risks through small and large-scale disasters. ReMapRisk is a community-led tool that enables the mapping and analysis of often under-recorded everyday risks, such as water and sanitation-related diseases, and small-scale episodic disasters, such as fires and localized floods. The tool allows local communities to document and monitor how risk accumulation cycles or urban risk traps materialize over time, where and why, feeding spatial and temporal details into an interactive online database. Using mobile phone applications such as Survey123, the tool allows trained community mappers to collect georeference data directly into pre-designed surveys on the phones, which is subsequently uploaded into ReMapRisk. The tool then allows a detailed disaggregated analysis of the hazard events recorded and of vulnerabilities and respective capacities to act within a particular community and a wider town or city surveyed. Enquiries on the data collected can be made at the settlement level, but it is also possible to design the process for the household level for a more detailed analysis. ReMapRisk provides fresh insights into how and why risk accumulation cycles or risk traps occur, and enhances the capacity to act of local communities at risk, as well as state and external agencies to work strategically, inclusively, and collectively. In Karonga and Freetown, ReMapRisk has supported the prioritization and development of specific strategies to move from risk mitigation towards prevention and reduction. ReMapRisk has been developed by the Bartlett Development Planning Unit at University College London as part of the research program Urban Africa Risk Knowledge, also known as Urban Arc. Urban Arc seeks to open up an applied research and policy agenda to reduce disaster risk in urban sub-Saharan Africa by breaking cycles of risk accumulation. The program focuses on a number of cities confronted by different risk challenges in the context of urban growth, poverty, and climate change. ReMapRisk has been applied in the town of Karonga, Malawi, and in Freetown, Sierra Leone, with the intention of developing and expanding the application of the tool to other African urban centers. Karonga is a rapidly growing township in the northern region of Malawi, with an estimated population of 63,000 inhabitants. The town exemplifies how and why risk accumulation works in rapidly expanding small urban centers across sub-Saharan Africa. While the old town is sparsely populated by 11 villages established for centuries, nearly half of the current 44 settlements that make Karonga today emerged during the colonial era, when land was further subdivided to accommodate demographic growth and the relocation of existing villages from flood-prone areas after catastrophic events. Over the years, Karonga town has recorded the largest number of disasters in Malawi, with flooding being the most prevalent. Intensive risks such as earthquakes, large-scale flooding, and strong winds have negative but less frequent impacts across the town, while extensive risks such as fire outbreaks, localized flooding, and waste dumping hazards tend to occur periodically, affecting localized spots with severe impacts upon the most vulnerable. The same applies to everyday health hazards such as respiratory illnesses and parasitic and vector-borne diseases like malaria and diarrhea, all of which remain poorly recorded. The decision to tackle risk accumulation was spearheaded in 2013 when a disaster risk management plan was produced, involving government authorities, traditional leaders, and local communities. Under the leadership of University of Mzuzu, Urban Arc has been instrumental in supporting the establishment of neighborhood or village disaster risk management committees, and ReMapRisk in building local capacities to document and monitor risk and to turn information into action. Freetown illustrates the conditions that affect many primate cities in sub-Saharan Africa, where urbanization underpinned by spatially and socially unequal development is driving the production of risk accumulation cycles, often exacerbated by climate change. The topography of Freetown, a peninsula constrained by the sea and the hills, limits the spatial expansion of the city, forcing low-income groups to settle mostly on marginal lands. In these settlements, flooding, rockfalls, building collapse, and landslides are a common phenomena, which result in the destruction of property and infrastructure, and also in injuries, diseases, and fatalities. Due to poor basic infrastructure, the incidence of epidemics, especially of waterborne diseases, is significantly high. Women and men living in informal settlements respond to extensive risk through their collectives, notably the Freetown Federation of the Urban Poor, through sensitization and self-help initiatives, and through the establishment of local disaster risk management structures, as well as through a range of initiatives supported by NGOs and external support agencies. Despite significant efforts both in Karonga and Freetown, disaster risk management continues to be mostly geared to react to emergency and crisis and large-scale disaster events. To address this gap, local communities in both cities adopted ReMapRisk to produce systematic information on how multiple hazards impact local lives and livelihoods, where and why, and to develop a proactive approach. The database stores information on hazards, vulnerabilities, and capacity to act, and enables public inquiries across all fields of information recorded, and can be visualized through maps in response to each query. This section offers an interactive assessment of the hazard profile of each city and allows inquiries at the neighborhood or settlement level based on empirical accounts of hazard events and perceptions of severity and effects. You can interrogate ReMapRisk to understand the relative intensity of different types of hazards, expressed as high, medium, and low. For example, what is the hazard profile of the villages in Karonga? And consequently, be able to see what is the hazard density across the whole town. You can also explore the temporal basis of hazard occurrence in a settlement. For instance, how often and where do landslides accidents occur in Freetown? Users can also interrogate why local dwellers in certain areas are more vulnerable to specific hazards than in others. For example, what villages in Karonga have high vulnerability due to poor construction and the use of unstable building materials? Or in Freetown, which settlements are highly vulnerable to water-related diseases due to high density and poor access to water and sanitation services? This section allows an interactive assessment of the capacities to act of local residents, authorities, and other support organizations in relation to particular hazards and vulnerabilities. For instance, you can examine what initiatives have been specifically implemented by local NGOs to improve access to water and sanitation. The data gathered also reveals what type of interventions have been implemented to reduce different risk threats. For example, users can see the spatial distribution, density, and types of interventions that exist in particular settlement, or across the whole city or town. ReMapRisk also allows users to ask multiple inquiries across the 3 previous domains. For instance, you can ask to see what is the perceived number 1 health hazard in Karonga villages that are frequently affected by floods and were settled prior to independence? Or what government-led initiatives have been undertaken in those Freetown informal settlements that experience recurrent flooding? Last but not least, ReMapRisk allows users to learn how women and men in each city experience different hazards and vulnerabilities, as well as their views on what should be done to tackle risk accumulation.
My name is Yusuf Conte, Dwaza community.
Yusuf, what is in the way happen in our community?
Well, my Dwaza community, we get a series of things and way they affect me. But I would like to talk about the drainage and the dirty. As you can see, the drainage small, you don't neat, you don't make fine. You send the dirty inside the gutter, where you can any side when you see, I did the dirty the tap. And you see, I need the dirty that affects you very much because see that dirty water resettle. So what you see the fly on top now, mosquito, and the mosquito the fly go inside the host them go bet me. You understand? So now some of the things I know the face around here.
name Amatu Bangura, 42 Sudan Bay.
Amatu, not the main two that affects you now.
A fire because of bad connection and cable caused fire. The host are all burn. And we lost properties then, and now the place will be blocked out because of the fire. Now pan body we just don't patch for not able to get side for sleep because we don't lost boko of the property there. We not able to cooperate for make block out. So right now so pan body they will live on.
The accumulation of preventable risks not only has severe impacts on the lives, livelihoods and assets of the urban poor, but also undermines the efforts and investments made by local communities and authorities, and ultimately, the potential benefits offered by cities and their socio-economic environmental future. Information on who is at risk, where and why is essential to break this vicious cycle and to strengthen local capacities to make cities inclusive, safe, resilient and sustainable, or in one word, just.
So why